Chapter 32. The Skin Tool. A. Injuries to the skin. Here in an extract from a medical website. Mechanical injuries to the skin are divided into tools caused by a blunt force, such as a punch from a fist, and tools caused by a sharp force, such as a knife, injuries from blunt forces, and abrasion is a superficial injury involving only the epidermis, which has been removed by frictions. A scratch is linear, as in fingernail scratches, whereas a graze involves a wider area, as in abrasions caused by dragging part of the body over a round surface. A contusion is an injury that occurs when blood vessels in the skin are damaged. A laceration is a wound involving both the dermis and epidermis. It is usually distinguished from penetration or incise wounds by its irregular edges and relative lack of bleeding. Injuries from sharp forces, an inside wound is a break in the skin where the length of the wound on the surface is greater than, than the depth of the wound. B. Cause report. Read the cause reports and compare it with the illustration. Cause 2. A 9 years old boy present to the accident and emergency department as after he stumbled and fell while returning in a walk. He had received a blow to the head from a rock and had been scratched by bushes. On examination, a vertical laceration 1 cm long was not on the bridge of his nose, just right of the midline. And C. Sores. The word sore is a popular term for many different types of skin lesions, especially infected lesions. A pressure sore is a skin ulcer caused by pressure, for example, the pressure of lying in bed for long periods. A cold sore is a lesion caused by herpes simplex. Note, the adjective sore means painful, for example, a sore throat. Ahora en español, capítulo 32, la piel 2. A. Lesiones traumáticas. Abrasión, contusión, laceración, herida incisa y herida penetrante. B. Caso clínico. Niño con golpe, laceración, abrasiones y contusión. Y C. Llagas, úlcera por presión y herpes simple. Chapter 33. The urinary system. A. Urinary symptoms. Urine is formed in the kidneys and stored in the bladder until it is passed. Patients may say, I have some pain when I pass water pee. Doctors may say, are you having any trouble with your waterworks? Doctor and Mr. Jones. Doctor, are you having any trouble with your waterworks? Mr. Jones. Well, I do seem to have to go to the toilet more often than I used to. How often is that? It depends, but sometimes it's every hour or even more often. What about at night? Do you have to get up at night? Yes, nearly always 2 or 3 times. Do you get any burning or pain when You pass water? No, not usually. Do you have any trouble getting started? No. Is the stream normal? I mean, is there still a good strong flow? Perhaps no kid so good as it used to be. Do you ever lose control of your bladder? Any leaking or dribbling? Well, perhaps a little dribbling from time to time. Have you ever passed blood in the urine? Urine? No, never. Common urinary symptoms, then their definitions. Frequency, frequent passage of urine. Dysphoria, nocturia, urgency, stance, urinary incontinence, and hematuria. MB, urinalysis, is the analysis of urine. Simple screening tests of the urine are carried out with reagent strip, for example, Kleenex for the detection of glucose. More detailed tests are carried out in a laboratory on a specimen of urine. Typical specimens are a mixed-ring specimen and a Cotterer specimen. Microscopy examination may reveal the presence of red blood cells, cells of cast. Blood signs are used in cast notes to indicate a normal fendence. A small amount is described as a trust. Capítulo 32. Sistema urinario. A. Síntomas urinarios, frecuencia, disuria, nicturia, urgencia, excitación, incontinencia y hematuria. B. Análisis de orina. Glucosa, proteínas, sangre y cilindros. Chapter 34. Basic investigations. A. Ophthalmoscopy. Allows the doctor to examine all parts of the eye: the iris, lens, retina, and optic disc. For best results, the examination is done with dim or lower lights to allow the pupil to maximum delay or wind. A tropical mydriatic solution may be applied to the eye to aid dilatation. The patient is then asked to fixate or a target for the duration of the test. B. Blood pressure. A stethoscope is used to hear the sound of blood rushing back through the artery. The first thumping sound is the systolic blood pressure. When the thumping sound is no longer heard, that's the diastolic blood pressure. NC. Taking blood. During being poured or the phlebotomist technician will take blood, inserts a needle into a vein, and withdraw blood into a specimen tube, which is sent to hematology laboratory for analysis. Usually, the phlebotomist can find a vein in the inner part of the elbow, the antecubital fossa, that is easily accessible. She may apply a tourniquet tailored to make the vein more prominent. Afterwards, the patient may be asked to press lightly on a dressing, usually a piece of gauze, to help to blood to clot and to prevent swelling and hematoma. Note: a bruise is a specific mark. Bruising can be used to describe a number of bruises or a larger area. The patient exhibits bruising of the right forearm. Ahora en español, capítulo 34, investigaciones básicas. A. Oftalmoscopía. Examina iris, cristalino, retina y nervio óptico. Se usan gotas midriáticas. B. Presión arterial. Instrumentos esfigmomanómetro, estetoscopio, presión sistólica y presión diastólica. Y C. Extracción de sangre, venopunción, torniquete, muestra y laboratorio.